A positive outlook tonight on the pandemic from the White House. U.S. President Joe Biden says he does not anticipate further travel restrictions in light of the new coronavirus variant, Omicron. Biden addressed the nation for the first time since Omicron was detected today. And while he said the new variant was no cause for panic, he urged Americans to get vaccinated and booster shots to protect against all variants of COVID-19.
The very day the World Health Organization identified the new variant, I took immediate steps to restrict travel from countries in Southern Africa. But while we have that travel restrictions can slow the speed of Omicron, it cannot prevent it. But here's what it does. It gives us time. It gives us time to take more actions, to move quicker, to make sure people understand you have to get your vaccine. You have to get the shot. You have to get the booster. Sooner or later, we're going to see cases of this new variant here in the United States. We'll have to face this new threat just as we face those that come before it. This variant is a cause for concern, not a cause for panic.
Well, meanwhile, countries around the world are closing their borders in an effort to slow the spread of this new variant. And that's despite World Health Organization advice to keep borders open and to focus on testing and tracing. Japan is the latest to introduce new restrictions banning all foreign arrivals beginning Tuesday. Morocco has halted all inbound flights, and Israel has closed its borders completely for 2 weeks. The U.S., Brazil, Australia, and Indonesia are among countries to ban travelers from southern African nations or to impose strict quarantine measures and partial lockdowns.
Dozens queue for a jab at a Cape Town drive-through as South Africa battles a fresh surge in COVID-19 cases. Adding fuel to the fire, the new variant Omicron was recently detected in the country. Since its discovery was announced, several countries have placed travel bans on South Africa and other neighbouring states. African leaders reacted with widespread condemnation.
We call upon these countries that have imposed travel bans on our country and our other Southern African sister countries to immediately and urgently reverse their decisions and lift the bans they have imposed before any further damage is done on our economies and to the livelihoods of our people.
The head of the World Health Organization also opposes these travel bans. WHO officials have been calling for improved cooperation and vaccine equity for months, precisely to avoid a situation like this.
The emergence of the highly mutated Omicron variant underlines just how perilous and precarious our situation is. South Africa and Botswana should be thanked for detecting, sequencing, and reporting this variant, not penalized. Indeed, Omicron demonstrates just why the world needs a new accord on pandemics. Our current system disincentivizes countries from alerting others to threats that will inevitably land on their shores.
Many EU countries are among those who've recently issued travel bans. And with the new variant now discovered in several European countries, their primary concern is on immunization.
First and foremost, highest priority is vaccinate, vaccinate, vaccinate. Boost, boost, boost as much as is possible, because this boosting or vaccination raises the level of antibodies and stimulates the memory cells for COVID viruses. Therefore, this is the police of the immune system that you are reinforcing during that time.
Back in South Africa, the vaccination rate is only at around 25%. In other African countries, it is less than 10%. Some say the latest variant is the likely result of vaccine hoarding by rich countries, because it has allowed the virus to spread among the unvaccinated and therefore mutate more quickly.
All right, let's get a status report on exactly what we do know so far about the Omicron variant of the coronavirus. My colleague Anthony Howard is here in the studio. with me, and we haven't even had a week to process news of this new variant.
Yeah, it's been dominating the news for days now, Brent. So let's take the chance to take a look at what we know so far, and let's be honest about what we don't know so far about the Omicron variant of COVID-19. 4 bullet points for you. It appears more contagious than Delta. Scientists warn that it is highly transmissible, perhaps even more so than the Delta variant, itself a super transmissible variant of the original. Onto the symptoms then, including exhaustion and aches. Initial evidence from South Africa, even though it's a very small sample size, show a high prevalence among young people, with many feeling exhausted and having muscle aches. A hint of good news here that we're attaching no small amount of hope to. We do not have a full data set though yet, and it may take weeks to get to the bottom just of that one on symptoms and how this variant works. Next up, it's unclear if it's more deadly. Experts caution that, like with symptoms, it's just too early to judge whether it causes more severe illnesses and deaths than other variants do. Also unclear if it is resistant to vaccines. It was one of the first headline notes taken on this variant, and let's be honest, it jumped right off the page for everyone who's been vaccinated, that it could be resistant to vaccines. Well, that too, it's also too soon to know if current vaccines are totally effective against it, or if advertised, Omicron is evasive to vaccines, or even partially. It's just too early to call. Everything we hear at this point is anecdotal, in that it's not scientific or not yet of sufficient sample size. Bottom line, as much as we may want to know and know now, this variant has the full and undivided attention of the world's virologists, but in terms of conclusive proof, Brent, about how exactly this works, it's not going to be days, but rather weeks before we know for sure.
Yeah, I mean, we should stick with reason. There's no reason to panic, and we'll wait for the science to catch up with the variant.
Sure.
Anthony, thank you. And for more now, I'm joined by Christian Lindmeier. He is a spokesman with the World Health Organization. He joins me tonight from Geneva, Switzerland. Mr. Lindmeier, it's good to see you again. What is your take on this accusation that the emergence of a new variant may be directly caused by this vaccine inequity that we have on the planet?
It's definitely possible that there's a link. I mean, because it's exactly the scenario we've been warning against since the day we have vaccines available. That the more room we give the virus, the easier it will change, will adapt, because it wants to survive, it wants to multiply. Hence, we will face at some stage a mutation, a variant that we cannot grasp anymore. And we're going that direction now. So yes, there is a part to that which is true.
And we're hearing here in the European Union, also in the United States, the message to the public, get vaccinated and get your booster shots. But if you look at South Africa, most South Africans have yet to get their first shot. Does that mean countries that are suffering from a lack of vaccines, for them, this new variant is more dangerous and more dire than it is for Western countries?
That's difficult to say yet, because we don't yet know the severity of this virus, of this variant. So Omicron is not yet fully known. It looks like it's more transmissible. That's what the preliminary evidence shows, that it might also break through immunity possibly easier. But we do not yet know much about the variant, and we do not know whether it's more or even possibly less severe. So we have to wait for that to see. But yes, the more a virus spreads in a community or a society which is less vaccinated, the higher the risk that we have more severe cases there, that we have more people in the emergency wards, and therefore blocking up the healthcare system, and therefore also enabling in a chain reaction other diseases to come up. Let's not forget, this is not an isolated show. And if one society is hit by that, then again, we come back to square one. Then the virus will mutate and change and will come back to us all. So yes, we need vaccines out there to as many people as possible, but on your personal level, if you are offered a third shot because of your your immune system is maybe requiring it, and you want to get your immune reaction up, then yes, you should take it. But on a national level, let's try to share as much as vaccines as possible with those who need it most.
Well, we have been in this pandemic now almost 2 years. COVAX was established by the UN to make sure that poorer countries have access to the vaccines. So, and it hasn't worked. We're 2 years into this pandemic. So where is the failure here? Is it at the UN level, or is it the criticism that rich countries are hoarding vaccines? I mean, who is not doing what they're supposed to be doing?
I would like to put it slightly different. COVAX works. The system of COVAX works. It means that when there's vaccines or financing available and vaccines available, then these can be distributed to countries with lower income, which are not in a position to purchase vaccines themselves. What doesn't work in the system is that not enough vaccines are being made available, or countries bilaterally buy up vaccines so that there's not enough available for the COVAX system to purchase them and to distribute them. So I'd like to make that distinction there.
Okay.
But yes, the situation is grave. Not enough vaccines reach the poorer or the low and middle income countries.
We know about this new variant because South Africa has very good coronavirus sequencing and transparency also. They alerted the world. What about these travel restrictions, though, to Southern Africa? Is South Africa being punished for doing what it's supposed to do?
Yeah, the Director General warns against this, and you hear also the president from South Africa voicing this, and it looks a lot like it, because just because you're ringing the alarm bell, you should not be the messenger that gets killed or beaten in this case. But there's a lot countries can do. Let's not forget that. The fact that in European airports or around the world, in Canada and the US, not yet, but in Canada, we found cases is simply because there was enough testing done and surveillance done to find those cases. And this is the way to go. There are many steps or many possibilities where we can actually know what the picture is and not punish a country, but also if we cut flights to a country, that means a lot of things. There are many implications, not only for that particular country. We may not get help there. We may not get more evidence from that country. We may not get also something back from that country. So we're living in a globalized world, so everything is interconnected. You cannot isolate a problem like that you just point the finger at one position and then that solves it. We are all connected in this.
Christian Lindmeier with the World Health Organization. Mr. Lindmeier, as always, we appreciate your time and your insights tonight. Thank you.
Thank you.
Well, here in Germany, the outgoing Chancellor Angela Merkel and her successor Olaf Scholz have brought forward a meeting with the leaders of Germany's 16 federal states to this coming Tuesday. Tougher COVID-19 restrictions are expected to top the agenda. With infection rates skyrocketing in the east and south of the country, the German armed forces are flying patients across the country to ease the strain on healthcare teams and to find beds in hospitals with more ability to cope. Germany has confirmed 3 cases now of the new Omicron variant, further complicating matters. The country is already battling its 4th major wave of infections. All right, let's go straight to our political correspondent, Leonie von Hammerstein. She is covering that angle for us tonight. Good evening to you, Leonie. That emergency meeting now has been brought forward more than a week. Does that show the urgency, and what can we expect to hear come out of it?
Yes, Brent, it definitely shows that governing officials here in Germany have understood the severity of the situation. Whether or not we can actually expect, results coming out of it and swift action to follow that phone call tomorrow is another question, and it depends on a variety of factors. First of all, whether there will be a clear allocation of responsibilities between Germany's outgoing government and the incoming governing coalition, because at the moment Germany is sort of in this leadership vacuum. It also depends on whether Germany's 16 state premiers will agree on a common path forward, something that's been difficult in the past. And, under Germany's federal system, the states have significant powers to decide their own restrictions, which has led to a situation where the country finds itself with a patchwork of rules. Just one example from last weekend, there was a football game in the western city of Cologne where it took place in front of, a packed stadium with 50,000 people, whereas in the eastern city of Leipzig, the game took place to empty stands. And thirdly, it depends on a ruling that Germany's highest court is expected to issue tomorrow morning on the legality of past lockdown measures, such as curfews and contact restrictions. And governing officials, will depend on that ruling what measures will actually be put on the table.
And Leona, we know a military man, Army Major General Christian Lindmeier, is set to lead the new emergency task force. Do we know the reasoning for appointing a military official?
Well, it seems to be a clear recognition that logistics is crucial at this point of the pandemic. Whether it's getting booster shots to patients or the vaccination rollout in general, or whether it's transferring patients from areas that have reached ICU capacities to areas in the country that haven't yet. The German armed forces have played a significant role in this, and continue to play a significant role. And the likely nomination of General Breuer will, is a clear attribute to the recognition of that importance.
Leonie von Hammerstein with the latest tonight here in Berlin. Leonie, thank you.